Hi, this is Reggie from Restore Plus Physical Therapy. As you all know, I don't like pushing pills, or I don't like telling people to take pills, right? Um, Now, sometimes I have patients who come in and they share the same mentality. They don't like to take pills. The question there is, when or is there a right time to take pain pills, or when is the right time to take pain pills? So at least I want to give you my answer there. Now, I don't like pushing pills, or I don't like telling people to take pain pills, is because it's just like a band-aid and people tend to get dependent on it. I know a lot of people, they actually even, some of the patients, when I ask them, the medical history, what medications they're taking, I started noticing that a lot of people actually take Tylenol, take Motrin. They take it like they're taking multivitamins every day, and they just keep popping it and popping it. They get dependent on it, and they get to the stage that they actually don't feel the relief anymore there because their body's so used to it. All right, so that's one of the main reasons why I don't like people taking pain pills, aside from it's bad for your health, it's effect on your liver and everything else, right? There's a lot of other different factors there. That aside from that, it's when people get dependent on it, or it doesn't work for them anymore. Now, when is the right time to take pain pills, or is there a right time to take pain pills? That's some of the questions that my patients ask me, and what I'm gonna say is, in my opinion, there is a right time. When is that? For example, I have patients coming in with knee replacements or some surgery that they have a lot of pain, right? We have to move the leg, or we have to move that certain joint. But if the patient cannot tolerate that, it limits us, it limits the therapist on what they can do during that session. So during that time, I actually would tell some of my patients, hey, you know what? An hour before you come see me, can you take your pain pill? That way, when you come in, I'll be able to be more effective. I'll be able to do what I have to do to help you get better faster. So that's one instance that I tell people that they can take pain pill, because this is not permanent. This is not long term. This is temporary, like a week or two. Once we start getting them moving better, they usually don't have to take the pills anymore. Or we combine that with heat or with cold, and that helps them get the pain relief, and then we do away with taking the pain medication. Another time that I tell people that I want them to take the pain pills, if the pain is interrupting their sleep at night. Now, sleep is very important. It is during deep REM sleep that will heal the most, that the body heals the most. So we have to be able to sleep for your body to heal. If you're recovering from an injury, recovering from surgery, sleep is very important, and you have to be able to get a good sleep, or a decent sleep for that matter. So if you're not able to do that, taking some pain pills might be able to help you do that. So you can do it. Again, this is going to be temporary, it's short term, it's not long term. We don't want to get you hooked on it, and if once we start moving the patient, they get more flexible, they start using hot, cold, other modalities, and get them more comfortable that they can sleep better, then we do away with the pills, right? So those are just a couple of instances that I tell people, you know what, don't be too afraid of taking pills, because I look at it this way, does the pros outweigh the cons, right? Your benefit will outweigh either the negative there. At least in my opinion, that's how I look at it. Everybody will have their opinion there. I'd love to hear your comments, and share this with the people friends and family. Subscribe to our YouTube channel. You can like us on Facebook and follow us on Instagram. I'll see you on the next video. Bye.